Marhaba and welcome to today's episode of The Doc Is In. I'm Dr. Saima Khan and I am delighted to be your host today for this podcast, which has been brought to you by the Imaging Institute at Cleveland Clinic, Abu Dhabi. I'm joined today by my two wonderful colleagues, Dr. Zabair Ahmed and Dr. Naghma Nawaz.
Thank you for inviting us.
Yeah,
Pleasure to be here.
So Dr. Naghma is our consultant radiologist who leads the breast radiology team at Cleveland Clinic. And Dr. Zabair Ahmed has worked very closely with a very dedicated team in the last couple of years, increasing the breast cancer screening rates at our hospital.
Thank you very much for the introduction.
So Zabair, I believe in the last couple of years, you and Dr. Naghma have been working incredibly hard to increase these breast cancer screening rates. You had introduced a pink booth, and that created a lot of awareness. And I believe this is coming this year as well. Do you want us to walk us through what it means for the patient journey and how does that make it easier for patients to get screening?
Absolutely. Well, thank you very much for the very kind introduction. And basically, life is busy. Okay, we have work, we have children, and it's very difficult to find a convenient appointment. And if your work is on the far side of Abu Dhabi, even taking an hour of your work, traveling through the traffic and getting to that appointment and getting back work often puts people off, and people miss screening because screening is done before you have symptoms, and sometimes we don't prioritize that. And often people prioritize their health once a symptom arises, and that might be too late. And so the whole idea of the pink booth is during the October Breast Cancer Month, where obviously people are more aware, particularly women obviously, aware of breast cancer, we made it easier. So from the 1st of October to the 15th, we will be running a booth on the ground floor in the Cleveland Clinic, Abu Dhabi, where we will have volunteers raising awareness, and if you stop by, they will be able to answer any questions about breast screening and ask you a few questions to see if you are eligible. According to the Department of Health, all ladies from the age of 40 to 70 are recommended to have screening at least every 2 years. In some instances, and we recommend from 40 to 55 at least annually, and I'm sure Dr. Nawaz will explain why we say that. During this month, we have an aim that if you're eligible, we will then get you seen on the day by one of our primary care physicians. The first part of breast screening is to have a consultation with a primary care physician. During this consultation, we will take your history to make sure you don't have any red flag symptoms. Common red flag symptoms are breast pain, lump, changes to the skin, or a discharge. Because if you have any of these symptoms, then you may warrant different screening rather than the standard mammogram and a more specialist opinion from a breast clinic doctor, and then a different type of scanning, which we will discuss later in the podcast. But if you are eligible and nothing is found on the family for personal history, we then check the family history. Sometimes there's a strong family history of breast cancer, and that may warrant a referral to having genetic screening in our high-risk clinic, and these individuals may require additional screening. And we'll talk about later in the podcast the difference between the different types of scanning available for these types of patients. Generally, after this point, provided there's no contraindications, the main ones to consider if the lady is currently pregnant or breastfeeding, if there's no recent flu jab, because that can sometimes affect the interpretation. We would then whisk the lady away on this special occasion straight to radiology to have a mammogram on the day. And our aim is from the time she presents to the pink booth, we want to get her turned around within an hour to make it as less convenient as possible. And then obviously afterwards, the mammogram will be reported and we will follow up as appropriate. And that will be running from Monday to Friday from 10 a.m. all the way to 4 p.m. Friday slightly different because of allowing time for the Friday pay. Will start a little bit earlier at 9 a.m. and again finishing at 4 p.m. So if it's on your mind and you are struggling to find an appointment, but you're going to be in and around Cleveland Clinic Abu Dhabi, pop in from the 1st to the 15th of October. We will do our best to get you screened.
This sounds fantastic, like 1 hour. This is great. So, Dr. Naghma, often when we do these consultations in primary care, women question about the choice of screening. So many women ask, I mean, why should they go ahead and do a mammogram? Why can't they just skip it altogether and do an ultrasound instead? Because, you know, for some women, they think that it might be more uncomfortable. And then I have had patients who have asked, oh, a family member had an MRI breast, so why can't just I do an MRI breast? So how would you explain different imaging modalities and what is better than other? Yeah.
So the thing is that according to the scientific data, till now, the gold standard to screen for breast cancer is mammogram. So it doesn't matter whether you're looking at the European guidelines or American guidelines, every guideline would state mammogram is the gold standard. Hence, we ask for it. So I try to explain to my patients that a mammogram is like having a map in front of you. So the entire breast is visible to you in one go. And then we can decide whether we want to do something about a particular area or can we let this patient go home today,
Sure.
right? An ultrasound is very operator dependent, and you can miss little corners, little edges by just doing just doing an ultrasound scan. So hence, you have to start with the roadmap, and then you can proceed to other modalities. So that's the difference. So one of the issues patients do express, as probably they do you too as well, is the radiation dose.
Yeah.
So there's a big buzz about, oh, this requires radiation. So the radiation required for a mammogram is minimal. So if you consider the CT scans and the other chest X-rays, and we don't even think twice before getting one done. But the focus tends to be on the mammogram. But the radiation dose is extremely low when it comes to mammogram. And so many studies have been done which have proven that, your risk of doing a mammogram every year for the next 20 years would increase your chances of radiation-induced cancer by less than 0.6%. So hence, the radiation is not really worrying. Other studies would say something like, people don't even realize the background radiation we get exposed to.
Sure.
So if you take a transatlantic flight, the radiation you get exposed to one leg would be equivalent to getting a mammogram done. So I think the focus, you have to tell them that it's not really that much radiation.
Sure.
The third thing they do ask about is the discomfort, that, it's very painful. So most of the time, so if you go towards the older machines, they were less comfortable, the plates were not as soft, and then also people, if they were not trained, were compressing too much. So if you come to a place where you have state-of-the-art machinery available, you have extremely qualified, specialized mammographers who are going to do the mammogram for you. So they tend to come out and say, this was not as bad as I thought it would be. The compression lasts for a few seconds. The mammogram might, take you 10 minutes to do both breasts, but the compression itself only lasts for a few seconds, and as soon as the image is taken, the compression is lifted.
Sure.
So it's not as uncomfortable as females start imagining. So that's that thing. And now coming to your question of MRI breast. So MR is a great tool, but till today, all the studies say that it should be used as an adjunct, add-on to other modalities. The reason why they say it is because the false positive, which means extra findings which should not be addressed, is very high. So it does pick up, it's highly sensitive at picking up abnormalities or cancers, but it's also highly sensitive at picking up normal things which you would not do anything about in a normal circumstance. So you might end up over-treating the patient. So you might end up asking for biopsies and following them up, for next 2 years, every 6 months. And so that's why all the studies would still say you should use it as a supplement to mammograms, but not as your first line of action and follow-ups.
So lots of undue anxiety, I suppose, if you're getting an MRI,
Yeah.
no need to investigate if you don't really need it. So you mentioned ultrasound, like the biopsy just now. So when we call patients back with the test results, they often get quite nervous when they hear that they need a biopsy. I mean, sometimes they feel that if they're being asked to do a biopsy, it just means they have cancer. Or they feel that if they have a biopsy, then they had a biopsy last year and they don't need any further imaging. And I don't know whether you have heard, Zabair, I had women, raise concerns that if they have a biopsy, it just means that this will disfigure their breast. What would you say to the women listening? I mean, how do you address these concerns?
So we try to bring their apprehension down, especially in asymptomatic, meaning you don't have any symptoms, or you're not feeling a lump, there is no abnormality. Why am I going for a biopsy? So if you again follow statistics, about 15% of the patients who would get screening mammograms will be called back. We will investigate by doing an extra view or an ultrasound, depending on the abnormality. And most of those patients will be sent home. They will not have anything. Sure. We are just doing this as an extra thing of protection that, we want to look a little deeper, as we say. So as most patients would not have anything done, they'll be fine, and they will find out on the day that there is nothing there. Then the tiny percentage of patients which will require a biopsy, even those biopsies, most of them will turn out to be completely benign findings. So you could have had a small fibroadenoma, you could have had some changes in the tissue, which were previous infection, inflammation, which you don't recall you had, but it just left an effect behind. So again, most of those biopsies turned out to be benign, and we can let them back into the pool. So the likelihood of us finding a cancer in about 1,000 mammograms, we would find about 5 cancers. So it's a very small percentage of cancers. But those cancers, if we do find, would be small, and their treatment plan becomes completely different. So they have a much better prognosis, their surgery would be limited, everything. So we're trying to find that little cancer before it becomes palpable or symptom, So
Dr. Naghma, would you mind talking us through what the procedure entails, so ultrasound-guided biopsy?
Sure. It's a simple enough procedure. How do we do it? We start with giving patients some numbing medicine. So she feels a little prick in the skin. The medicine goes in. It stings a little bit for a few seconds. I like telling them that it's like a bee sting. But some of them have turned around and say, I've never been stung. So how do you explain that? So it stings just a little bit. And then it takes literally a couple of seconds for it to kick in, and it starts getting numb. We also give them deeper local anesthesia, but we do explain it to them that, for example, it's like going to a dentist. It's the same medication, it's the same effect. Within seconds, the area will become numb. And once it's numb, they will not be feeling pain. We're very generous with our lidocaine, so we will give a lot. So, they do ask you, can you give me a lot? So we will give you a lot. And we also reassure them by telling them that even during the procedure, if you feel pain, you just have to tell us, and we will just top up the local. So once the local is working and everything is numb, what do? We put a small cut into the skin. It's very, very small, because that's the one apprehension. One step further is that cut, I'm going to be left with a scar. So it's a very small cut. It's about a centimeter or so. It's just for the needle to glide in. So we put the needle inside, we get to the lesion, we take a few samples. After we take the samples, we leave a little clip behind. It's a biopsy clip. That's the next question we get asked about, that why are you leaving a clip in me? So the clip is left for 2 reasons. One, if the biopsy result comes back as benign, the clip will stay inside the patient for life, so that every time she gets an ultrasound, mammogram, or anything done anywhere in the world, because these are universal clips, and any breast radiologist can recognize them. So they will know that this area was already biopsied. So it's basically, the guideline is that, don't re-biopsy the same thing again and again. The second reason we do it is because if, for whatever reason, the pathology says this lump needs to come out, it doesn't necessarily need to be cancer. Some of the benign lumps, like things like phylloides tumor, recommended to be excised. So if that is the case, then the surgeon doesn't know where to go and which lump to take out. So this is just to make sure that the right lump comes out on the day of surgery. So that's why we mark it for them. And we explain that on the day of the surgery, the sample will come down to us. We will actually look at the sample under X-ray guidance, and then we will call the surgeon immediately and tell them that you do have the right lump out. So all of this is done for the surety that the right surgery is done for the patient. So that's why a clip is important. What is the clip? Clip is made out of titanium, which is a special metal. It's not like a normal metal. So another very common question is it going to buzz when I go through the airport?
Yeah.
So the answer is no, it will not. And we explain to patients that, people have big, plates for fractures, they have hip replacements, shoulder replacements, that doesn't buzz. So this tiny little thing is not going to buzz. It's less than 5 millimeters in size. So even if they wanted to, they would not be able to feel it. They can't palpate it. It doesn't do anything. It doesn't cause a reaction. It just sits and marks the place. Yeah. Completely safe to have. So even if a patient requires MRI scan of any body part at any point in life, they can tell that I have a clip which is made out of titanium. It will not affect the MR scan. So hence we always use these clips, which do not harm the patient in any way. So after we drop the clip, we make sure there is no bleeding happening. We apply compression for a few minutes, roughly about 10 minutes. Then we put a small dressing on the cut. The cut is so small, you don't need to stitch it. We also cover it up with a waterproof dressing. So if a patient wants to take a shower, she can. Just no soaking in the water, like bath or swimming, but showers are fine. They have to keep it on for 3 days, and then they just peel it off, and it should have healed. So that's how the procedure goes.
So after a couple of days, they shouldn't even feel that they had the pain or the
most of our patients tell us that once the numbing disappears, which takes about 4 hours, they say we didn't feel any pain.
Oh, excellent.
So, once you address all those apprehensions and questions, they tend to get relaxed, and then they understand that it's not a very difficult procedure to go through.
And Zabair, have you noticed that we are getting the mammogram results so quickly now in the last couple of months, I would say, or even a bit, Yeah, absolutely.
And I think this has all got to do with the new state-of-the-art technology, the artificial intelligence we're using, because, before this, it used to take a couple of days before we get the report. And you can imagine the kind of emotions a patient might be going through waiting, because naturally the tendency is that, the longer I wait, there must be something wrong, when naturally all it is there's only so many reports that Dr. Nawaz can do in a day. So it's not necessarily mean there's something bad that's lurking, or we're just trying to decide what we need to say to the patient, and that's why we're taking our time. But I believe with the AI software, it immediately reports on the mammogram and highlights to you any areas of concern, and then you can prioritize which reports to report immediately, and so you can get that report back to me as soon as possible. And literally, if it's not by the end of the day, I'm ringing the lady the next day if there's an area of concern, and then I can put the right context in, because, I'm saying, yes, we found something. It doesn't particularly look suspicious. It could be a fibroadenoma, but because we want to be sure, we're going to get an ultrasound to look at it from a different angle, or in some cases, you recommend a dedicated mammogram, so just zooming in the area. And I think at this point, I'm probably going to steal what you said at the beginning of the podcast. I quite like the idea of that initial mammogram is like a roadmap. What do we do when we're planning something difficult? We need a plan. And this is all it is. And that's why I can't stress enough, don't jump to an MRI first. Get the foundation of a good initial mammogram, because everything starts from there, And so I'll come back to my point. I know I went off in a little tangent, but I thought it was important to emphasize that again. So I've had a big impact, and I certainly think the patients appreciate getting their results quicker. But I'd be interested to know from your perspective how it's made your working day different using our AI reporting software.
It's definitely a great help. I say that, it's like having this super resident or fellow working right next to you
24/7.
24/7, and all they're doing is just going through the pile of work and finding that important document for you. So it's literally doing that for us. So if we have 100 mammograms, it's gone through all of them. It has found the mammograms which it thinks it may have some important findings on it. It will flag it. It will automatically, on our work list, it will flag that these are the mammograms which AI thinks has findings on it. So it pulls our attention to them first. So we know that if it has a flag, let's report those ones first. And then we can go to the ones which AI thought is completely normal. You look at it, you address it, and many a times you were downgraded because it's not saying that it's definitely cancer. It is saying just look at this area because it looks a little different. So we look at it and we report it out. So it makes our life so much easier that the most important mammograms are pulled up on the list, and we first address that, and then we can go down the list to a latter part of the day that, okay, these would be normal, these we'll address later. So it's literally like having, we do double reading, as you know.
Sure.
We follow the DOH guidelines, which are very strict about every mammograms get read by two independent radiologists. But this is like having a third radiologist. So the better, number of eyes, the better the result. So it does help. And yes, sometimes it does make you look at things which you may have not paid attention, Sometimes one can be tired, but it's saying, please do look at this. So, so we would always, if it's flagged or not flagged, we would look at the entire mammogram ourselves. But at the last step, we will go to AI and check, has it flagged something which we didn't pay attention to? So it always is reassuring that, there's a third eye looking at it. So it definitely helps, and I'm so glad to hear that it helps you guys, and it helps the patients so much. Because as you know, there are days where you're swarmed under, and you're trying to struggle between your diagnostic work and screening work. But if we can address the highlighted ones, which AI has flagged for us, at least we know that anything which needs to be addressed today is addressed today.
Well, there you go. So if you have a mammogram at Cleveland Clinic Abu Dhabi, you get 3 for 1.
I know.
And third certified, which doesn't even need coffee.
I know.
And people don't realize with any test you have, there's always a small margin of error because of the human input. And that will be with MRI scan, more so with user-dependent like ultrasound. And so that's why we always want to be at the front of any technology, and we want to reduce that error rate as much as possible. Because the last thing we want to do is put a fear in your mind, and even though it might turn out to be nothing, it's still a very emotionally traumatic period, all sorts of thoughts go through your mind, you start thinking about your future, and then it could be just a horrible time. But if we can say, do you know what, we found something, we've had 3 people look at it, the third one is AI, it doesn't sound like it's anything suspicious, but we're going to tick all the boxes, we're going to get an ultrasound to be sure. Most women, when I've put it into that context, are really happy, they feel reassured. And then they make sure they attend that appointment, because that's the worst thing. They need an additional scan and then they don't turn up.
Yeah.
And we try our best to chase them up, but there's only so much we can do. And heaven, God forbid, they turn up 6 months, 12 months later down the line, and it's now something, and the options would be different. So it's really important, you follow through on the advice if you do need any additional scanning.
Yeah, I completely agree. And if you do need something, just to add to that, you are in a hospital which offers all kinds of treatments. So God forbid you do get diagnosed with something. we will internally hand you over to our oncology institute, which has a team of breast surgeons and oncologists and genetic counselors and, high-risk clinics and all of that. And they just take over and they take care of the patient. So you are within the same facility and everything has been taken care of. So thinking of high risk, I just wanted to pick Saima's brain on it. That if you can just elaborate a little bit, how do we decide which patient falls into the criteria of a high-risk patient?
Sure. So, like Dr. Naghma, you were saying earlier, not everyone would need an MRI scan now. There are some women who, based on their personal history or family history, if there's a compelling family history of different kind of cancers, they are assessed by our genetic specialist. And it's a specialized clinic which includes a physician and a genetic counselor as well. So they do a detailed evaluation. They sort of ascertain whether these patients will need any specialized genetic testing. They are counseled for it. And based on those results, they use validated risk calculators to understand lifetime risk of developing breast cancer in those women. And based on that assessment, there will be like individualized sort of plan as to whether, for example, some women may need to start screening way before the age of 40 years, right? And other women may need additional screening in addition to just a mammogram, they may need alongside with that an MRI scan. So I think this is, as you said earlier, this is a great facility because it's not just individualized radiology or a primary care or an oncologist. This is like a one-stop shop, a team where everybody works together just to make sure that we get the best for our patients. And as you said, if we are getting screening, things which are being picked up are way before you would actually notice the changes. So, and then you'll have a team to help those women. Yeah.
Great.
Yeah.
Thank you.
Thank you. So this has been such an insightful conversation, and thank you both for your expertise. And I'm sure you've answered most of the common questions women have regarding screening. So do you want to add anything?
I guess final thoughts from the 1st of October
Yeah.
to the 15th, if you're in and around Maria Island and you've just been putting off that mammogram or you're not sure if you're eligible, pop in. Come to the pink booth. It's right at the main entrance. You'll find our volunteers who are very knowledgeable. They'll answer all your questions. And if you have the time and we think you're eligible, we'll get you done. So please think about the first 2 weeks of October. Come and see us at Clinic Abu Dhabi.
So for the women tuned in and who are due for mammogram, and just please don't delay. You can book today. Thank you. Take care.
Thank you.